Now let's introduce the installation and operation process of the 980nm 6+1 laser therapy device. This is a hose, this is a foot switch, and this is a power cord, 110 watts to 220 watts and visual. This is the laser glasses, operator to wear. This is the eye mask for the customer. This is the fiber optic handle. This is the focus ring, respectively 0.2 mm, 0.5 mm, 1 mm, 2 mm, 3 mm. Adjustable the focusing ring, the large the light spot. These are the two treatment heads for removing red blood. The two are different in shape and scattered according to personal habit. When we choose the stage head, when using an elbow, you cannot choose the focusing ring. This is the onychomycosis physiotherapy head. The 0.2 mm focusing ring is commonly used. This is the pain physiotherapy head. This is tender skin anti-inflammatory physiotherapy head. This is eczema herbs physiotherapy head. This is ice compress hammer. This is Lipolysis fiber. This is Lipolysis fiber handle. This is stainless steel needle. Connect the power cord to the power socket, the foot switch to the switch socket, and the ice compress hammer to the ice compress hammer socket. Now, let's talk about the installation method of the optical fiber and screw the protective cap at the fiber port and the protective cap at the laser output port of the instrument and connect and install it. Once connected, it can be turned on and used without adding water, and it does not need to be coated with scale. Now power on. The instrument automatically enters the home interface. There are 6 buttons on the page, which are the red blood strip button, physical therapy button, onychomycosis button, skin rejuvenation button, eczema herbs button, Lipolysis button. Click the red blood strip button to enter the red blood shot operation page. Click the back button in the standby state to return the home page. Now click on the irinocyte removal button to enter the inorganic removal operation interface. The interface is very simple. There are 3 parameters in total. This is the power, this is the pulse width, this is the frequency. Click the plus less button to adjust the parameters. This is the power. If the value too small, it will not work. If it is too large, it will cause burn and blizzards. This is plus width. The plus width is the time that laser stay on the skin. If the value is too small, it will not work. When it is too large, the pain will increase and it will form. The common range is 30 to 60 milliseconds. This is the frequency. The frequency is the number of lasers emitted by the laser person. The common range is 2 to 3 Hz. This bulb is aiming light. Click this button to adjust the brightness of aiming light. The first gear is weak, the second gear is brighter, and the third gear is particularly bright. Generally, the first gear is used. You can see the red blood. It is too bright, but it's not clear. This is the energy count emitted by the laser after this power on. This is total energy count emitted by this instrument. Click the start button. Step on the pedal. The leader starts to output. The release the pedal to stop the leader output. If the parameters are not suitable, you need to return to the pause stage to adjust the parameters when you need to adjust the parameters. For example, if the energy is increased a little, or the pulse width is increased a little, click again and to start the treatment. This is the operation method of red blood capillary. During pain physiotherapy, click the back button in the standby state to return to the function selection page. Click the pain physiotherapy button to enter the physiotherapy operation interface. Gently unscrew the red blood treatment head. Replace the pain physiotherapy head and do not use focus ring. The operation method of the interface is the same as the interface of removing red blood. When the pain is treated, the power is usually 18 watts or more. The common range of pulse width is between 30 milliseconds to 50 milliseconds. The commonly used frequency range is 5 to 10 Hz. This is the button. It's the continuous output mode. This is the pulse output mode. Only the pulse mode is needed for the treatment of red blood. CW mode can be selected as needed for pain physiotherapy and onychomycosis removal. In this mode, care must be taken to prevent burns. After the continuous mode is started, the pulse width and frequency can no longer be adjusted. Only the power parameters can be adjusted. After parameters are set, you can operate it. The hand tool is vertically ended in a spiral manner. The physiotherapy part will feel hot. The specific treatment customer should be constantly asked about the customer's feeling and tolerance button to return to the standby state and adjust the parameters. For example, if the energy is increased a little or pulse width increased a little, click again to start treatment. This is how the pain physiotherapy works. When removing onychomycosis, click the back button in the standby state to return to the function selection page. And then click on the onychomycosis removal button to enter the onychomycosis operation page, and replace the onychomycosis treatment head with a 0.2 mm Ferguson ring. The power is usually 12 watts and above. The pulse width is usually in the range of 20 milliseconds to 40 milliseconds, and the frequency is usually in the range of 2 to 3 Hz. The hand tools are aimed at thick nails that need to be irradiated, and the nails will feel hot when they are irradiated in a spiral manner. The specific treatment time is based on the temperature, and the customer can accept it. During the treatment process, the customer's feeling must be constantly asked. Tolerable degree. This is how to get rid of onychomycosis. When skin rejuvenation and anti-inflammatory, click the back button in the standby state to return to the function selection page, and then click the skin rejuvenation and anti-inflammatory button to enter the skin rejuvenation and anti-inflammatory operation page. It is recommended to start the operation from 12 watts. If there is no sensation, the energy can be increased little by little. Generally, 12 watts to 20 watts is more suitable. The common range of pulse width is 10 to 12 milliseconds, and the common range of frequency is 10 to 30 Hz. The treatment head irradiates the skin vertically, about 5 to 8 centimeters away from the skin, and the skin feels slightly warm after about 6 seconds of irradiation. The duration of irradiation and the length of treatment are determined by the doctor according to the individual treatment range and depth. It is recommended that its area be treated no longer than 3 minutes. The interval period is recommended 1 to 2 times a week. This is how to rejuvenate and reduce inflammation. When treating eczema and herpes, click the back button to return to the function selection page in the standby state, and then click the eczema and herpes button to enter the operation page of eczema and herpes. Change to the eczema and herpes physiotherapy head without Ferguson ring. The power is usually 20 watts and above. The pulse width is usually in the range of 80 milliseconds to 90 milliseconds, and the frequency is usually in the range of 6 to 7 Hz. If there is no feeling, you can increase the energy little by little. The treatment head is vertically irradiated 2 to 3 centimeters away from the skin. It is better to feel a cell warmth after about 5 seconds of induration. The induration time and the length of treatment are determined by the doctor according to the individual treatment range and depth. 10 to 20 minutes, 6 days as a course of treatment, 2 days intermittent of the treatment, heal and stop treatment. This is how to treat eczema and herpes. When using the lipolysis function, turn off the instrument and screw the orbital fiber handle. Replace and lipolysis fiber and tighten. Unscrew the fiber handle from the middle, and then pass the Lipolysis fiber through the end of the handle, and then into the middle position of handle again. Tighten the middle until the end of the handle. The end is tightened to lock this fiber that is installed. When you need to enter the lipolysis pad, click Lipolysis button into Lipolysis page. The parameters are set by professional doctor according to personal conditions. This is the operation method of laser lipolysis. When a cold compress is needed to cool down, use an ice compress hammer. The ice compress hammer can be used immediately after the instrument is turned on. It has nothing to do with the screen program. Long press and switch on the ice compress hammer to turn on the ice bag function. The longer to use time, the lower the surface temperature of the ice compress hammer. Adjust it appropriately according to specific situation. The time should not be over long. If the patient is found to have adverse reactions, it should be stopped immediately to prevent front bite.